Hi there, welcome. Thank you for joining us for Day of Beauty. Today we are going to be doing a sublative RF treatment for Vanessa here, specifically for her acne scars. So her main concerns are her cheeks, just to help with the texture, tone, and help stimulate a little bit more collagen and elastin to help smooth out her acne scarring. So this is going to be her first treatment, so she's a little bit nervous, but we did have her numb at least 30 minutes before her treatment just to make it a little bit more comfortable. So we're going to go ahead and get started. So what sublative RF is, it's pretty much just heat delivered to the dermis of the skin to help stimulate more collagen and elastin. And what that's gonna do, it's just gonna help with her texture and acne scarring. So it's gonna help tighten the skin and smooth her texture. Okay, is that okay? Is that comfortable? Okay. Yeah. This laser is a little bit warm, so we do have you use our Zimmer, which is just our cooling air. So I'm gonna give her this just so she's a little bit more comfortable. I'm going to give you that just 2 holds right there on the chest. Perfect. Alrighty. So we already cleaned her skin, wiped her skin down. This laser requires you to have like dry skin. So her skin is clean and dry. Okay, we're gonna go ahead and get started. So this is our applicator. It has like 64 little pins that create these little grid marks on the face. And that's what's gonna create those the heat to deliver to the dermis, and it's going to create these little grid marks. And the surrounding skin is just normal skin, just so it heals a little bit quicker. So this is a great treatment for minimal downtime, all skin types. So great treatment for anybody that's looking to help with their texture. We're gonna get started. Vanessa, you ready?
Yes.
Okay. All right, so we're gonna do 1 pass here, just so she knows what it feels like. Great candidate for this would be for anybody with any texture irregularities. So if you're looking to kind of improve the texture of your skin, again, acne scarring, just to help smooth out your skin, it's a great treatment for anyone looking to improve their texture. For acne scarring, we recommend at least 3 to 5 treatments for a month apart, so 4 to 6 weeks apart from one another. And typically you do want to maintain your results by getting one every 6 months to a year.
Can you combine this with any other treatment?
Yes, so we usually combine this treatment with our package called our Trinity Plus, which is an IPL to help with the tone of your skin. And then we also do the Sublime just to help tighten the skin a little bit more. And then the Sublative as well, just to help with the texture. So it's a great treatment to combine just for overall skin resurfacing and tightening and brightening. So great treatment for those looking just to help refresh their skin. So once we're done with everything, you're going to feel like a mild sunburn. So for the first hour, we typically just tell you to either ice the area just to help with that burning sensation, or just kind of go in front of a AC just to help bring the temperature of your skin down. But after we're complete with the treatment, we're going to just be applying a gentle moisturizer, which is a repair cream, and then some sunscreen. So I do want you to go home and stay out of the sun.
Okay.
And just kind of cool your skin down a bit. And then after that 1 hour, usually that mild sunburn sensation goes away, and you are left more with a little bit of redness, a little bit of swelling, and just tender skin. So make sure just to keep everything simple, avoid direct sun exposure, and then tonight, I want you to wash your face, gentle cleanser, moisturizer, that's a gentle moisturizer repair cream, and then tomorrow, same thing with sunscreen, okay? No makeup for at least 2 days. After 2 days, you can go back to wearing your makeup, okay?
Okay.
So that redness, that swelling usually resolves in 1 to 2 days. And then after 1 to 2 days, you'll start seeing that you have these little grid marks. And the grid marks are just that, those little micro injuries that are created with the laser to help stimulate the collagen. So they'll start flaking off usually by day 3 to 5. Typically around your mouth it's going to be a little bit quicker. Usually cheeks and forehead tend to take a little longer for those to come off. So just be gentle with your skin. Don't over exfoliate. Don't rub them off prematurely. So just whenever they're ready to come off, they're ready to come off, okay?
Okay.
Any questions on the aftercare?
So I usually, for my cleanser, I use medicated cleanser, salicylic acid for my acne, of course. Do I use that one, or do I buy a more gentle cleanser?
So we do want you to use something more gentle. That one has an active ingredient, which is the salicylic acid. So that's a little too harsh for your skin while it's recovering. So I want you to hold off on that for 7 to 10 days. Until your skin is completely back to normal, okay? After that, you can go back to that product or that skincare product, but for now, just a gentle cleanser. So any gentle cleanser is fine. CeraVe, Cetaphil, Neutrogena. We'll get you some samples just so you have something to use while you're recovering.
Okay. What about my tretinoin? Should I continue that?
I want you to wait on your tretinoin until your skin is back, just like the salicylic acid wash, until your skin is back to normal. So no actives. That includes your tretinoin, your salicylic acid for 7 to 10 days. As soon as your skin is back to its normal state, then you can go back to those products but for those 7 to 10 days, I want you to just keep it simple and gentle. So we're gonna go back and just cover any areas that have not received those grid marks. So we're just kind of going back to those areas.
How long for those grid marks to go away?
So she'll start noticing them day 2, and then typically it can take anywhere from 3 to 5 days for them to go away. Sometimes up to 7 days, specifically the forehead, just because there's a little less movement there. So she'll notice around the mouth, those are going to exfoliate a little bit quicker, and then her nose, cheeks, and then forehead last. So expect to have them at the most for 7 days.
Okay. How many of these would I need to like start seeing improvement?
So we want you to start coming in at least once a month, and up to 5 treatments 1 month apart, but you'll see the most change happening after your second treatment. So first one, it's mild, minimal, but the more treatments we do, the better the results start, the more improvement you start seeing on your skin. So after that second one, you're really gonna start noticing a bigger change to your skin. So we'll have you come back in a month and we'll have you do another treatment.
That's good.
All right, I want her to make sure to get a good treatment. So any of those areas that are white, I just go back. And it's a little tedious going back and forth, but
Now I get a good result.
so we're gonna get close to your eyes here. that side looks good. Let's go back over here. A little closer to your eyes. We're almost done, City. Sorry. Nose is a little hard just because there's curves to it, but got a little treatment there. Okay, we'll just stop there. Okay. Yeah, how are you feeling, Vanessa? You okay?
Mm-hmm.
Yeah? So as we can see, we're a little red and pink right after the treatment. And again, she's gonna feel like a mild sunburn for about an hour, but that's gonna improve. It's usually that first hour, and then she's gonna be a lot more comfortable after that. So we'll give her some ice packs just so she can ice. 15 minutes every hour as needed, and then after that point, she won't need any ice packs. And this is just our Cyclophate Repair Cream that we love using post-treatment, just to help with her healing. And we're gonna put a little bit of tinted sunscreen just to help kind of with the redness a little bit, so a little color to it. So any mineral sunscreen is great to use after this treatment. And again, Vanessa, I want you to be very cautious with the sun. Wear your sunscreen every day. Wait 2 days before you start applying any makeup, okay?
Okay.
Alrighty, so we are all done. All right, well, thank you so much for joining us for Day of Beauty. Don't forget to ask about our Sublative treatment if you're looking to help improve your texture, tone, any acne scarring. So it's great a treatment for those that are looking for improvement on their texture. Thank you.